What are malignant colon polyps? Imagine discovering a small growth inside your colon that looks harmless but could actually be a sign of early cancer. That's what a malignant colon polyp is. These are growths on the inner lining of the colon that contain cancer cells which have invaded beyond the surface layer into the deeper tissue underneath. And like benign polyps, which are non-cancerous and usually don't cause symptoms, malignant polyps are an early form of colon cancer. They are classified as stage T1 in the cancer staging system, meaning the cancer has started to invade the submucosa, the layer just beneath the mucous lining of the colon. During an endoscopy, these polyps might look benign or just like regular growths, but microscopic examination shows that cancer cells have penetrated into the deeper layers. Most colon polyps are abnormal clusters of cells that grow on the lining of the colon. The majority are benign and don't cause symptoms, but some, especially adenomatous polyps, have the potential to turn into cancer over time. Malignant polyps often develop from these adenomatous polyps through a step-by-step process involving genetic mutations that transform normal cells into cancerous ones. This progression can take years, which is why screening is so important. Key features of malignant colon polyps include histological invasion, meaning the cancer cells have penetrated through the muscularis mucosa into the submucosa but haven't yet spread beyond the muscle layer of the colon wall. This invasion helps distinguish malignant polyps from more invasive cancers that have spread deeper into the colon. The risk of spreading to nearby lymph nodes varies depending on factors like how deep the invasion is and the type of polyp. For example, pedunculated polyps with superficial invasion have a very low risk of spreading, around 0 to 3%, while sessile polyps with deeper invasion can have up to a 25% chance of lymph node involvement. Malignant polyps can be either pedunculated, which means they have a stalk or a mushroom shape, or sessile, which are flat and broad-based. When a malignant polyp is detected, removal through colonoscopy is usually the first step. It's best to remove the polyp in one piece, called en bloc removal, so doctors can examine it thoroughly. If complete removal isn't possible or if certain risk factors are present, surgery might be needed to remove part of the colon. The outlook for patients with malignant colon polyps is generally good if the cancer is caught early and completely removed. Because these polyps are early-stage cancers, early detection and removal can prevent progression to more advanced disease. After removal, patients need regular follow-up to check for any new polyps or signs of recurrence. The key is that, if the cancer remains confined to the polyp and is fully excised, the prognosis tends to be favorable. In summary, malignant colon polyps are early-stage cancers that develop from certain types of benign polyps that have started to invade the deeper layers of the colon wall. They differ from benign polyps because they contain cancer cells and have the potential to spread, especially if not detected early. Screening colonoscopies play a vital role in identifying these polyps before they turn into more serious cancers. Early removal through endoscopy or surgery can significantly reduce the risk of colon cancer developing further. Always consult healthcare professionals for personalized advice and screening options to maintain colon health and prevent disease.